A friend of mine called me and said, Akash, I have a fatty liver and I don't even drink. Now, what he's got is something called a non alcoholic fatty liver or NAFL. And what's scary is that this condition now affects over 2.5 billion people globally. So I invited my friend over, and when he came by, I asked him this simple question: Dude, can you point me towards your liver? And he froze for a moment, looked a bit unsure, and then vaguely pointed somewhere over his stomach and said, "Here." And that's when it hit me. Most people have little or no clue about their bodies. They're mostly in the dark. And it's never about having enough time, it's more about priorities. But what is important is that you are here today, and I want to take this opportunity to teach you everything I can about liver health as much as possible. By the way, we have got plenty of free guides and ebooks to help you master the foundations of health. All these are free and you can find their link in the description below. I encourage you to set aside just a few hours each week to learn the basics about your own body and health. All right, now I want you to take your right hand right now and gently pat right under your rib cage. Just get the screen here. Okay, so your liver sits diagonally on the right side just beneath your diaphragm. And if you gently press that area, and if it feels a bit tight, tender, or stiff, it could be that your liver is asking for help. Ideally, it should feel soft, okay? And it should not be painful if you try to go a bit deep. In this two-part series, I will talk about liver health. I will give you pretty much everything you want to know about your liver, except for the anatomy and physiology part, which I reserve for people who want to nerd out with our holistic nutrition coach certification. So for a discounted link, you can check out the description box below. So let's get started with a quick visual cue. So take a look at the white of your eyes, which is called the sclera. If they are reddish, it could be a sign that your liver is inflamed. And if you have been following my videos, you know that inflammation is step 2 in the healing process. Meaning there has been some kind of cellular damage and your body has kicked into a repair mode by inflaming a given area, in this case your liver. So basically your eyes are a window to your liver health. And when they turn yellow, we all know what that is. You guessed it right, jaundice. So the liver is incredibly resilient. It can regenerate itself, but it's not invincible. Okay. When it's constantly bombarded with sugar, refined carbs, stress, alcohol, medications, processed foods, or environmental toxins, it starts to wear down. And the scary thing is that in the beginning, you won't feel much. And that's why so many people don't even realize that their liver is in trouble until the damage has gone much further. So let me walk you through 3 main stages of liver damage so that you can understand where problems begin. So stage 1 is fatty liver. This is the starting point. Too much sugar and excess calories lead to fat being stored in your liver cells. And you don't have to drink alcohol for this to happen. That's why it's called non-alcoholic fatty liver. And the symptoms? Often nothing. Maybe a dull ache on the right side of your belly. Maybe you feel tired a lot. That is probably, fatigue has started to set in. But mostly silence. And that silence is dangerous because it lets the condition creep forward. And it brings you to stage 2, fibrosis. Now the fat buildup causes extensive oxidative stress and inflammation. Your liver tries to heal by laying down scar tissue. To use an analogy here, think of it like your favorite t-shirt getting torn and sewn back together. The stitched area is never quite the same. It's rough, stiff, and doesn't stretch. That's what scar tissue does inside your liver. It blocks blood flow, stops nutrients from getting in, and traps toxins inside. So at this stage, certain liver enzymes and blood markers will start going out of range. We'll get to those in just about a minute. And the final stage is cirrhosis. This is when the damage is advanced. The liver's architecture is permanently altered, lobules and functional units extensively damaged. And now it struggles to do even the basic jobs like detoxifying blood, making proteins, balancing hormones, and so forth. You might notice yellow skin or eyes, which is jaundice, a swollen belly, easy bruising, confusion, fatigue, or even muscle wasting. And this is usually when people finally start to take notice, but by then the damage is serious. So let's take a step back and ask ourselves why these liver problems happen in the first place. So here are the 8 underlying root causes. Please do click a screenshot for future reference. I'll just move forward. Now let's get into the testing. I want to give you 7 key blood markers that can tell you how your liver is doing. So the first blood marker is called ALT. It is also known as SGPT. It is an enzyme made in the liver. High levels mean liver cells are leaking into your blood, often from fatty liver, hepatitis, or medication damage. Healthy range is between 10 to 30 units per liter. Second is AST, also known as SGOT. This enzyme is found in liver, heart, muscle, and more. So high AST alongside ALT points to liver issue. So if AST is more than twice ALT, it may suggest alcohol-related damage. Third is ALP, alkaline phosphatase, is an enzyme found in the liver and bones. So if your bile ducts are blocked from gallstones or liver congestion, ALP tends to rise. But here's a trick, ALP can also go up from bone growth also. So my 11-year-old son had a sky-high ALP, but his liver is just fine. So ALP must always be interpreted with GGT. GGT is more specific to the liver. So when it's elevated along with ALP, it confirms the problem that it is liver related. It also spikes with alcohol, certain meds, and early fatty liver. Bilirubin, this is the yellow pigment created when the body breaks down red blood cells. The liver is supposed to process it and send it out through bile. But if your liver's struggling, bilirubin builds up. And that's when the white of your eyes turn yellow, jaundice. Sixth is albumin. It is the main protein your liver produces. Low albumin can point to poor liver function, chronic disease, or malnutrition. It also keeps fluid in your blood vessels. So if you can see swelling or bloating, low albumin might be a clue. And seventh is total protein. This measures both albumin and globulins and gives you an overall picture of your immune system, liver function, and protein status. Low protein means liver disease, gut issues, or protein deficiencies. All right, okay, so that's a lot to take in. Click a screenshot of this liver test table. It will come in handy the next time you go in for a full blood test. Remember this, your liver isn't just some passive detox organ. It is a metabolic powerhouse, a chemical factory, and hormone regulator. It deserves some love. So in part 2 of this video series, we'll dive exactly into how to take care of your liver with herbs, nutrients, and supplements. And of course, a holistic lifestyle. So make sure you subscribe. The links to free fabulous guides and ebooks to master the foundation of your health are in the description box below. Do check them out. I'm Akash. Thank you so much for your time.